So in this video we're going to talk about the importance of good mental health after birth. The first thing I'll talk about is something called baby blues, which I'm sure many of you will have heard of being described in books or in the media. Baby blues refers to that couple of days perhaps after birth where many women have feelings of feeling a bit overwhelmed or just feeling very teary, very emotional, and I'd say a good 80 to 90% of women experience some kind of baby blues after birth. Perhaps this is caused by the changing levels in hormones in a woman's body following birth. If we think about while the baby and the placenta are inside, your hormone levels are quite high, and then baby out, placenta out, and those hormone levels come down really quickly. So baby blues is thought to perhaps be this physiological response to that drop in hormones. So what do we need to do? Well, lots of love, lots of reassurance that this is entirely normal, and supporting mum to get as much rest as she's able to. Midwives will use this little mantra a lot and say, if the baby sleeps, try to get some sleep yourself. This can be hard in the first couple of days after birth because we're so in awe of this new little person that's in our lives and wanting to almost watch them in our arms or in the cot if they settle in the cot, and watching for their chest rising and falling and to check that they're okay. And our bodies are sometimes pumped full of adrenaline after birth, so it can be hard for mums to switch off. But babies are pretty good at letting you know if they want you, so try to get some rest if you can in between the times when your baby is wanting to feed. So lots and lots of reassurance, lots of cups of tea, slices of cake and cuddles, and as much help as possible. Baby blues is sometimes exacerbated perhaps by having had a long birthing process. Maybe you did have a really long piece of string, maybe missed a couple of nights before your baby's birth of rest, which can also help you feel more like this and more emotional. Maybe that you had some stitches or you've got a little bit of discomfort after birth. So do speak to your midwife and make sure that we can help keep you as comfy as possible. For most women, the baby blues passes after a couple of days at most. But for other women, then it doesn't go away, or perhaps it gets a little bit better, but then comes back in a stronger way. So what I'm moving on to talk about now is postnatal depression after birth. Again, something that many of you probably will have heard or read about before. Postnatal depression is really common and affects as many as 1 in 10 new mums, and can also affect new partners too. With any mental health subject, we're getting much better at this as a society, but there is still a little bit of a taboo around talking about mental health and the importance of good mental health. But as healthcare professionals, we're trained to understand how common it is and to look for the warning signs or the signs of recognising that there's some postnatal depression there. So say for example a midwife with a caseload of 20 to 30 ladies, it wouldn't be uncommon for 2 to 3 of those women to have some form of postnatal depression. So it's really important to be aware of it and to talk about it. The first step to helping you is to recognise that there is some postnatal depression there. And once it's been recognised, we can then put a plan in place to give you some help to overcome that period. Every lady's different, and postnatal depression can manifest in many different ways. Women who suffer from postnatal depression might describe feeling particularly anxious all the time, or particularly tired, perhaps wanting to sleep all the time, or even actually not being able to sleep, that the baby is sleeping for periods of time but mum finds it really hard to switch off and to rest. Perhaps feeling very low, very weepy, finding it difficult to take joy in things. Perhaps finding that this transition to motherhood isn't the experience that she thought it would be. Perhaps kind of not having that rush of attachment with the baby. We use these buzzwords of attachment and bonding a lot following birth, and it's really important to acknowledge and recognise that bonding and attachment may be an entirely different experience for each new mum, just as it may be for each new partner. You love your baby already, you've carried them around for the last 9 months and you know your baby. Birth is just the final part of that process. But bonding and attachment is going to be different for everybody. If you think about the people in your life now and the people that you love most dearly, I'm sure you can perhaps think of one person who, when you first met them, you didn't have that initial kind of rush of attraction, of attachment to, and that it was actually spending time with that person, getting to know them, that then that love developed. And the same too for baby, that it can be a different process for everybody, and some will get that initial rush and others it might take a couple of days or even longer. It can also be difficult for mums who have found some part of their birthing journey difficult or hard. Perhaps you did have a really long piece of string and you're absolutely exhausted at the point of birth. Perhaps that birth journey didn't go as straightforward as you had hoped for, and it did take twists or turns that you may perhaps be struggling to understand or to accept. So for these mums, it can make bonding attachment an altered process. If there is anything that you're wanting to discuss about birth, please know that we have a service called Pregnancy and Birth Revisited, where you can make an appointment to come back and speak to a senior midwife about your birth journey or anything in your pregnancy that you want to understand or make sense of. And sometimes when women come along to this, we can discuss with you what has happened in your pregnancy or your birth journey and help you make sense or to understand perhaps why that happened, or to offer some reassurance of what might happen in the future or in a subsequent pregnancy. So please do know that this service is available. So how do we treat postnatal depression? Well, for some mums and new partners, it might be something very simple, like some self-help. So taking some time out for you to perhaps enjoy doing something just for you. Something just as simple as going and having half an hour to have a nice long soak in a bubbly bath, or curling up with a book or a magazine and switching off, listening to some music, going out for a walk or having some exercise. Exercise is great, and as a general rule of thumb, listen to your body and your body will tell you what's comfortable. But just something as simple as going out for a bit of a walk in the fresh air or a jog is going to do wonders of boosting those feel-good hormones of oxytocin and endorphins and helping you feel better in yourself. Making sure you take time to have regular meals, so keeping well hydrated, plenty of nutritious meals. Accepting breaks when you're able to take one, so let your partner and friends and family who are around you to support you. Spending as much time as you want cuddling and holding your baby. Generally, babies want to be close to us and feel more settled and calm in that close hold with parents. But it actually has feel-good hormones too for new parents. So spending a lot of time with your baby close can help to calm you and to make baby feel more soothed as well. For other mums, it might be that you need a little bit more support than that. So perhaps some talking therapy, just speaking to your healthcare professionals like your midwife, your health visitor, your GP. Maybe you need a little bit more than this. Maybe some counselling or some cognitive behavioural therapy is also sometimes used to treat postnatal depression. And then for others, it might be that you need some support with some medication for a period of time. Medication that is quite safe to take with breastfeeding, that your GP will be the healthcare professional that starts you on the medication and keeps in touch with you to monitor how this is doing. Many women do feel awkward about talking about postnatal depression. Please don't. As we've said, healthcare professionals are trained to understand how common it is and trained to support you in finding that help. There's no guilt, there's no fear of the healthcare professional being judgmental. It's about giving you sufficient support to help get past that period of time and to promote good mental health.